Good afternoon, and thank you for joining us for today's We Care for Kids Town Hall. I'm Mike Feakin, Strategic Partnerships Advisor at First 5 Nebraska and President of the Nebraska Economic Developers Association. I'll be moderating today's event. This event is made possible through a partnership between the Nebraska Economic Developers Association, First 5 Nebraska, and the We Care for Kids campaign, a statewide effort in Nebraska to build support for quality early childhood education. Parents, families, teachers, and communities are coming together to raise awareness about early childhood care and education and are working to ensure that families across Nebraska have access to it. The campaign is supported by organizations across the state and is funded by public and private sources, including the Nebraska Department of Health and Human Services and the Nebraska Department of Education. We're excited for the conversation today and to share how you can get involved. We want to hear from you today, and we'll be taking your questions soon. If you've joined us by phone, you can press 0 on your keypad at any time to be added to the queue to ask a question. For those of you watching on social media, please type your questions into the comments section. Before we get to our discussion, I would like to introduce our guests. We are fortunate to have Nebraska business leaders as well as representatives from early childhood education and community organizations from across the state. Claire Brown is joining us from the Wellbeing Partners, where she serves as the Child and Family Wellbeing Coordinator. Hello, Claire. Our next panelist is Dulce Sherman, Chief Human Resources and Diversity, Equity, and Inclusion Officer at the Nebraska Early Childhood Collaborative. Dulce also serves as the Board President of the Latino Center of the Midlands. Also joining us is Luke Virgil, the Executive Director of Wayne Area Economic Development. Now, before we begin, please remember that we want to hear from those of you watching on social media or listening by phone. You can submit questions by using the telephone number on your screen or posting your question on social media. If you are joining us by phone, just press 0 on your phone keypad at any time to be added to the queue. Okay, let's get started. Now, to kick us off today, we have a representative from Nebraska Extension, Dr. Holly Hattenbowers, to share some exciting findings from a recent statewide survey. Thank you for joining us, and I'll pass things over to Holly for a brief preview of the survey findings.
Thank you, Mike, for the warm introduction and for you all joining us today. We are so excited about the wonderful panelists gathered here today and are eager to begin this important town hall discussion. As many of you know, early childhood care and education is an issue that is top of mind for Nebraskans from all walks of life and across our state. Nebraska Extension and We Care for Kids recently issued a statewide survey to better understand the perspectives of Nebraskans and learn where childcare and early learning falls in comparison to other important priorities in the state. Today, we will preview a few of the important findings, and if you're interested in learning more about these results, there is going to be a briefing tomorrow afternoon to walk through the survey findings in full with the researchers. You can register to attend the briefing for free at nebraskacaresforkids.org under the events page located at the bottom of the site. So to kick off today, here are a few things we've learned from Nebraska voters. Nebraskans see childcare crisis in our state. Ranked against other issues facing the state, respondents place lack of quality, affordable childcare and early learning as being on par with crime and the cost of housing. You can see a few of the key findings represented here. 84% of respondents agree that Nebraska should support childcare and early learning like it does for K-12 schools and higher education. And 83% agree that Nebraska should make childcare and early learning a higher priority than it currently does today. Perhaps some of the more sobering findings from the survey include the childcare challenges faced by parents and families, especially those with children under age 5. 31% of parents with children ages 5 and under said that they left the workforce because they couldn't find affordable childcare. And nearly half have had to cut back on household essentials because of struggling to pay for childcare. This issue is impacting all Nebraskans in every corner of our state. Families feel it, businesses feel it, and communities feel it. If you want to learn more about the survey findings, please join us tomorrow for the public briefing from 1 to 2 p.m. Central Time to learn more. And information to register again for the webinar can be found on the We Care for Kids website. So finally, we're excited for today's discussion and how some communities are experiencing these challenges, and to learn more about how businesses can be part of the solutions.
Thank you, Holly. That's a powerful way to get our conversation started today. And let's start by getting our panelists' reactions to the survey findings. How do these findings align with what you are seeing in your work and communities? And I think let's start with Dulce Sherman. What do you think?
Well, first of all, the results are not surprising to me. As a parent of 4 boys, as a working mother, in the middle of my heart has always been having to find reliable, quality childcare for those boys. And so we know that children do most of their development by the age of 5. And so this is really, for me, almost a crisis to hear about these results. However, knowing that we have data now to support this information, I'm optimistic to hear that more are becoming more aware of the need for some action to happen in this state.
That's great. Now, Luke, again, how do these findings align with what you're seeing in your work?
I would echo with what Dulce says. This is something that we've seen for years in our community here in Wayne. We know that there is a shortage. It's good to see that the data matches. It matches what we've seen anecdotally. I think there is a silver lining from the pandemic, that this has heightened the awareness statewide for the need for high quality childcare and the important role that it plays in our communities, whether it's quality of life or just straight up economic development. And I'm glad to see that there's a willingness across the state to see that action.
Thanks, Luke. Claire, how do these findings align?
Yep, I am in full agreement with Luca and Dulce. I think it's alarming to see these numbers, but it's also really encouraging and really exciting when the numbers of what kind of the masses think in our community are aligning with what we're hearing in personal conversations and what we're hearing from individuals, because that means that we're ready to take action and we're ready to see some changes to support this problem.
That's great. Now, Dulce, I'm especially struck by the experiences of Nebraskans having to miss work, who turn down a promotion or a job opportunity, or leave the workforce altogether because of childcare struggles. How are you seeing this experience in Nebraska communities and with your employers?
Well, it's a very true fact. In fact, it hits home as a mother again. We've had mothers on maternity leave where I work at, in some of our centers too, that have not been able to return to work because they have not been able to find a quality childcare provider. And so it's been challenging for us to find qualified talent with less than 3% unemployment rate here in Omaha locally. Nebraska, if you think about it, Nebraska has really not recognized early child care educators as a profession, but yet we expect them to raise our children. And if you think about it, they're our future leaders. And without equipping these educators with benefits or pay or training, we really need to start thinking about how do we turn that around? Because again, we are raising our future potential leaders.
And I think that's such an important message of, making sure that we professionalize our early childhood workforce. That's great to hear. Now, Luke, as someone charged with economic development, what's your reaction when you hear that 31% of parents of children birth to 5 have said that they've had to leave the workforce because they can't find affordable childcare?
It's disheartening, especially when you put it into context of Nebraska's workforce landscape. We have some of the lowest unemployment rates in the nation. We have one of the highest workforce participation rates. And there's a significant job opening number across the state. I think it's 50, 60,000 the last I checked. What this does is it means that people who want to work are being excluded from the workforce because they can't find access or availability with childcare. And I think that's a really nasty line in the sand that we're drawing, excluding people.
Now, Claire, can you tell us what you're hearing from employers that you work with about these challenges?
Yeah, absolutely. So employers are struggling to keep people involved and keep people where they need them to be as they're trying to work. Like we've kind of covered, if you don't have childcare, it's hard to be at work. But the exciting news here is that employers are also beginning to wonder, how can we be supporting our employees? Historically, we think about employee wellness programming as supporting employees in the workplace around topics like smoking cessation or diabetes management. But now employers are seeing the challenges that families are facing, and they're beginning to ask, what's our role here? Instead of thinking that's a family thing, that's not for us to worry about here in the workplace, we're thinking actually it's a person thing, it's a people thing, and we need our people to be at their best at work. So maybe we do have a role in supporting this childcare crisis and supporting the well-being of families. And that's a good space for us to be moving into.
Exactly. Yeah, good space. And again, more good messaging. We will be taking questions from the audience shortly. Please remember that we want to hear from those of you watching via social media or listening by phone. You can submit your questions by using the telephone number on your screen or posting your question on social media. If you are joining us by phone, just press 0 on your phone keypad at any time to be added to the queue. So it's clear we do have a crisis in our state. Dulce, what can employers do to support families? Are there specific policies, supports, programs that they should know about?
Yeah, so taking us back to the 2 employees that I referenced earlier that were unable to return to work, we were flexible in extending their leaves. And I think that's the bottom line, is that workplace culture needs to be at the heart of retention of your employees and all equally your providers, because basically, again, they're raising our children. We need to really be thinking about whether our culture and our organization and our programs reflect that. Are we currently looking at paid maternity leave, policies that are parent friendly and really focus on retaining providers? NECC, in partnership with We Care for Kids this last year, as part again of recognizing the profession of early childcare providers, created the Early Childhood Champion. Again, it's very important that we recognize the profession. And so as a result, these childcare providers are receiving $1,000 for their hard work and commitment and excellence to their communities. So it's time for us to be creative and also think about the fact that we are raising children. What kind of culture are we creating for our employees to want to stay and be passionate about the children that we're raising?
Now, Claire, you mentioned a little bit about it, but how are you seeing businesses and employers supporting families? What role can businesses play to help this crisis?
Right. So we are seeing organizations really get creative on this topic. We have the tried and true solutions of providing on-site childcare options or childcare stipends to support the affordability of care. And those are still very valuable best practices. But we're also seeing organizations doing some of those parent-friendly policies like Dulce was talking about, flex time options or hybrid work formats that offer more flexibility around childcare needs. And while childcare is a major piece of this puzzle, it's what we're here talking about today, another piece of the puzzle is what happens at home in terms of parental stress and how that's affecting working parents as well. Last year at the Wellbeing Partners, we were able to launch our family wellness programming, which is an employee education program that provides opportunities for employees to learn how to support their child's development, how to support their child's mental health, how to vet for those quality care settings and partner with childcare providers, all those really good things. And since launching that program, we saw many of our Nebraska partners, businesses, organizations in the community choose to offer that programming to their employees while their employees are on the clock as part of their workday, not taking time away from their families. And since launching, we've been able to reach over 33,000 parents in the state of Nebraska with that information. Through this education, parents are feeling equipped for their role at home, and they're experiencing less stress related to parenting, and therefore are more engaged at work. And so there's much more to do on this topic, but we are really excited to see our partners taking this first step in supporting families and supporting their employees as part of a family and as human beings.
Yeah, less stressed as a parent, sign me up, right?
Right, yes.
Now, Luke, before we begin taking questions from the audience, how are you thinking about quality childcare as part of your overall economic development planning or strategy? What are the opportunities and barriers economic development leaders are facing?
I think the issue has been a top concern for me even before I came into this role here in Wayne. And now that we're seeing the awareness statewide build, it gives us the opportunity to really support programs either here in Wayne or throughout the state. I think like what Claire was talking about with implementing some of those best practices, the stipends, there's a lot of businesses that don't ever even think about adding a stipend into their wage. And so just educating them here in town that is an opportunity, but also building the awareness towards workplace culture and how important that is for workforce retention. I think the biggest barrier is going to be funding because these childcare programs are not cheap. But finding the right people to work in those settings is also very difficult. We've got to have people that love kids. I know it's something that I struggle with every day. I'm a parent, and I don't know how our childcare providers do it every day when there's 20, 30 kids in a building with them. So we got to find the right people, and we got to give them the right tools. And one of those big tools is the funding.
Yes, that's obviously one of the biggest questions. So now, switching gears here, we will take a few questions, and then from our viewers on social media, as well as our listeners on the phone. As a reminder of those of you that have questions, you can submit them by using the telephone number on the screen, posting them on social media, or if you are joining us by phone, just press 0 on your phone keypad at any time. So, first question. Okay. A question for Luke. As an economic developer, what kinds of questions do prospective employers ask about childcare or related issues when considering whether or not to locate jobs or facilities in Nebraska communities? And that was from Mike on Facebook. Thanks, Mike. So Luke, what do you think?
We don't see a lot of recruitment RFPs for businesses in our community simply because the workforce issue is so tight. We're right in line with the state with a 2% unemployment rate. But when we talk to our existing employers, we go back to what I said earlier. We educate them about the stipends or being flexible with work from home time, or just understanding how improving the quality of life at work is going to improve the quality of life at home too. And childcare is one of those quality of life pieces.
And I will actually just maybe do a piggyback or follow up on that. Is we have seen from economic development, from that side of it, with requests for proposals from those companies looking to relocate, that there is a more added emphasis from those companies understanding their workforce and their future employer needs. So there is now an understanding that they will be asking those types of questions about how, what type of capacity that the community has with provider, with childcare programs. So, how many spots are available? And then also we are seeing that they're asking about potential like quality settings. All right. So that is something that we are seeing on a statewide basis. Now, let's see here. We've got a question from Alexis for either Claire or Dulce. How can we help new providers wanting to start childcare to help with this crisis?
Well, I think that's a great question. And this is where Nebraska Early Childhood Collaborative comes in. We offer a toolkit program for anyone that is interested in opening up their own family childcare business, or if they're an existing provider that's wanting to become licensed. We offer free of charge a toolkit that they can sign up for. We also offer a business series of classes that they can keep up to date. So what that does for them, it really gives them their tools at their fingertips. They're also able to come on site if they need any resources available to their family childcare business. And often what we find is if there's mothers that cannot find daycare, one of the things that they decide is maybe I should open up a family childcare business because of the crisis that we're in right now. So if you know of anyone that is interested in wanting to start their own family childcare business, this is a great opportunity.
And the NECC toolkit is wonderful. It's very well done. Now, Claire, can you share with us what you're hearing from families about some of the challenges they're facing when it comes to finding childcare?
Sure. Parents want to be very picky about their childcare choices, and they really should be, right? We're talking about the most valuable thing in our lives. But a major challenge right now is that because childcare openings are so sparse, parents aren't given the opportunities to be picky. They have to really go with whatever provider has a spot for their child that they can afford. And that's really difficult for families. They should have a right to be choosy, which is why we're really hoping for more providers and more opportunities for families to select from these, in-home options. People starting those up and these great centers that we have. We want to see more options available so that families have some choice when they're deciding where to send their child.
I mean, yeah, you want to talk about parent stress again. Yeah, you're exactly right. Like when you haven't been able to fully, potentially vet where you're going, that just amps up that parent stress. Yeah. So what would you say is a first step that employers, businesses, or community groups could take in connecting families to the resources they need to find childcare that works for them?
Yeah. So first, for employers, I would say a first job is to be providing your employees with time to search for that childcare setting, because that often means visiting care facilities or meeting with child care providers. And those activities often have to happen during the workday, which makes it difficult for someone to, who's already working, to have time to do those things. But employers can offer time for people to take care of those needs. And then second, employers can be providing information to help support searches for childcare. And in Nebraska, there are so many wonderful organizations that are providing resources for families searching for childcare. And that's actually one of the goals of We Care for Kids, to bring all of those resources into one place that is easy to navigate. And that's a great place for employers to begin as they offer resources. So at nebraskacaresforkids.org, in the For Families section, there's information about how families can find a quality program in their community and learn more about what quality even looks like as they're making those searches. We also are able to link out to lots of amazing resources across Nebraska For example, the Nebraska Child Care Referral Network. It's even got a searchable map of programs available right in your area. We have Step Up to Quality Provider Search, which allows families to really see how providers are ranked in reference to their own set goals. The Nebraska Early Development Network for families of young children who might have concerns about developmental delays or healthcare needs. We've got a checklist from the University of Nebraska to help you choose quality childcare, and even information on childcare subsidies for families. So it's really a great list. It's a growing list. We're adding things to it. So if you have questions about those resources, or even have additional resources that you would like to see shared there, please reach out to the campaign team and we can help you with that.
Wow, that's an exhaustive list, but there's always room for more, right?
Yes.
So now it does look like we have we've got someone on the telephone line here, and it sounds like we've got Lisa in Elkhorn. Lisa, do you have your question?
I do, Mike. Thanks. Thanks to all of the panelists for sharing this important information today, and you've raised a number of key points. I'm wondering if you can point us toward a few Nebraska communities or businesses that are really leading the response with innovative solutions worth sharing.
I will open that up to anyone that would like to answer on the panel there.
I'm going to step up here. I'm obviously very biased because I work for Nebraska Early Childhood Collaborative, and having had two siblings that loved attending the early Head Start programs, I'd be advocating for the early Head Start program. And as we know, we offer, and we're very proud to be an early Head Start child care partnership grantee. We are able to help children and families place them in high quality early child care education services. And one of the things that I really resonated with my heart when Claire was talking about workplace culture is we provide a very caring workforce culture. And I think that's one of the things that as employers, we really need to think about how we're going to attract people that are passionate about the children that we work with, how we're going to retain the providers that we really want to be working with these children. And, bottom line, it starts there. And I'd like to think that Nebraska Early Childhood Collaborative is leading that because we do have a very strong, dedicated staff. And one of the things that I did mention earlier with our programs is that we also have education coaches that help providers that once they start their business, and if they need help with establishing their business, these coaches help these providers. And so I feel that we're very proactive in what we do in our programs, services to families, and also as an employer, retaining our employees.
Were there any other examples of communities or businesses that are really, I guess, stepping up? Claire or Luke, do you have anything that you want to add with that?
And I guess just on a meta level, I would say that what First 5 Nebraska is doing on the Policy Leadership Academy side of things, and then the Communities for Kids programming. I mean, these are two programs that are bringing that awareness level up very, very high, and they're encouraging the high quality end of childcare. Yes, we need to be able to have choices as for our children, whether it's a parent or a community, but taking it to the next level and getting that high quality education implemented is really important too.
Well, now, when you talk about First 5 Nebraska and the Policy Leadership Academy, Luke, you're going to make me blush. But as far as the Communities for Kids, the C4K, that's an initiative of the Nebraska Children and Families Foundation. And I think, to date, they are in 55 communities across the state that you're exactly right, that are trying to help provide community-based solutions so that each community can really find their own opportunities with early childhood education and care.
Yep. And I think
go ahead.
A couple of places that I've heard, I think, is it Shickley that invested a bunch of money through the Nebraska Community Foundation, that they implemented a community daycare center I think McCook has had a very good initiative the last couple of years. I think both of those places have been involved with PLA and with the C4K. So look at those graduates from PLA and the C4K map, and those are the communities that are doing it, because every response is going to be different, whether it's in Wayne or McCook or Omaha.
Yep. Now,
I would add
go ahead. I'm sorry.
I was going to add, the Buffett Foundation hosts a conference each fall called the Thriving Families Conference. One of my favorite parts about that conference is getting to hear success stories from different communities. Because like Luke was saying, it's very different in urban Omaha than it is from a rural area. But that conference does a great job of bringing people up to really celebrate the steps that they've taken, share success stories, share lessons learned. So if you're wanting to know more about how, quality could look and how we could solve these challenges, that's a great conference to look into.
That's a great reminder for everyone with the Thriving Conference, Thriving Children and Families Conference. Now, what I will, I guess, as we talk about professionalizing the workforce, and we talk about everything that goes in with that, I guess, Claire, for you, this is a Facebook question. How are we taking care of the mental health of our providers?
Yes, that's an excellent question, because that's so important, right? We can't pour from an empty cup, and providers are asked to pour and pour and pour and pour. So we need to make sure that we are doing what we can to fill that up. And I think, we could answer this question on many different levels. As a society, it touches on what you just mentioned and the professionalization of this role. We want our children to be in the care of professionals, which means we have to treat those people as professionals. And that means, some language changes. They are not babysitters. It's not a daycare. It is a childcare setting. They are caring for children, and they are, trained and doing excellent work in those fields. So treating them as, esteemed professionals that they are, it can go a really long way in helping them feel respected and supported. On an individual level, we think about, how parents are interacting. Are you showing appreciation? Are you able to, do that? It doesn't have to be monetary. It doesn't have to be gifts. I remember when I was in the setting myself as a preschool teacher in Omaha, those handwritten notes went so far and just really helped to fill me up and support me on the really hard days, because there are many hard days. So those kinds of ways we can really support teachers and childcare providers. I'll also say at the Wellbeing Partners, we had an opportunity to partner with Nebraska Department of Education to create teacher mental health care packages. Actually, this is a fun project that we got to do from last year. And we have a digital version that's available on our website. It's an easy way for a family to kind of print some of those resources out, share that with their teacher. It also includes some opportunities for teachers to receive and care providers to receive free counseling sessions online. So we know that that's often a difficult first step for someone to take. So if we can remove the barriers of finding someone and paying for that and going through insurance, it's a good way to start. And of course, we want someone to be established with a mental health provider if they need that. But this is an opportunity for someone to take that first step in getting some mental health support as it's needed.
So as a reminder, for those of you that have questions, you can submit them by using the telephone number on the screen, posting them on social media, or if you're joining us by phone, just press 0 on your phone keypad at any time. And now we do have a question from Chris in Grand Island for all panelists. How can I raise awareness about this issue on a local level? And it says that it asks that I respond first, but I'm not a panelist. I'm just a moderator, right? So I'll let Luke handle that first.
I think it's just integrating it into every conversation that I have. We've put this on a retreat agenda with our board of directors for the Economic Development Organization. We've talked about it with city council members. It's, there's lessons within the PLA guidebook that we've followed where we talk to every business owner. We talk to every parent in the local school district. If, it's just make it a part of your everyday conversation. And that's what heightens the awareness for us. I mean, and we've had a good discussion locally about it. And we've got one major commercial provider here in Wayne and several smaller in-home providers throughout the community and the surrounding area, and just being aware of who those people are and talking about them by name, treat them, like we said, as professionals, and make sure that people understand the value that they're bringing to our community every day.
Dulce or Claire?
I mean, I agree with you, Luke. I think it starts with how we're talking about it and that we're talking about it. It's easy, especially if you don't have children at home or this isn't a challenge for you, to feel like it doesn't apply to you. But that's really a misconception, because the children that are coming up, that are being raised right now, that are in care setting right now, are the ones who will be making decisions in our future. And that's really going to affect our whole society. So if this issue isn't affecting you personally at this time, I'd encourage you to talk to those around you who it is affecting, and, asking questions. When you chose your care setting, did you have choices, or was it a very limited selection? What is it like for you when you are having to take off work because your child is sick? Is your employer accommodating for that? Or is that a big challenge with your work setting? Just really getting a good idea of how this is affecting your community. And then that will help you as you have conversations and as you advocate for changes within your own workplace or at the local government level, or in whatever settings you have some power and authority.
I would agree with what Claire is saying. I'm a huge social media person. And so any posts that come out, I will share them right away with all my contacts. And nowadays you can get on Facebook and do a quick, live feed and get people involved and very active. I also believe in people following their senators and seeing what they're doing to help support this crisis that we're in right now. But if anything, in your circles, your immediate family circles, this is where the conversation needs to start, because it really hits home. Again, childcare is at the heart of every mother, every parent worrying about the quality of their children. And if we think about it, children that get left behind from education perspective, they're not going to be successful in school. And so we really need to think about how are we setting up the future of our children, their education, if they're not equipped by the time that they're age 5 to go into school. And so that needs to be everyone's problem, because it is the future.
And one of the things that I would, add on to that is, in my role, I go out, I go out to many communities and many organizations throughout the state and make presentations. And one of the things that I learned, or talk about, is that there are audiences that will say, well, it doesn't really affect me because I don't have young children, and I don't have any grandchildren that would utilize childcare. And so I started to kind of reframe that and using, some of the sayings that are around this business, is that, that everyone depends on someone that depends on childcare. And so when we start thinking about it that way, and that could be whether there's a doctor or a nurse that potentially can't make their shift because their childcare is unavailable that day, and what does that mean for you as a patient that is going in for some sort of appointment? Well, so that it's going to affect you. And the same goes for really any other kind of occupation. If what I'm counting on as a service is not available to me because the person performing that service is unable to go to work, then it's going to affect me. So that has resonated, I think, on local levels, is that everyone depends on someone that depends on childcare. We do have a question from Sherman County Department of Economic Development. The survey results mentioned supporting age 0 to 5 care the way that K through 12 education is in our state. What's our thoughts around this goal? Would it be nice? Wouldn't it be nice if there was availability for all and similar funding? Thoughts on that, and our tech gurus. I don't know if we can bring in Dr. Holly Hattenbauers on this as well, because it is with the survey. See if maybe we can do that. Thoughts overall on whether or not we can support ages 0 through 5 like we can the way that we do K through 12.
I would say 1000% support that. As you heard me say, that the children develop in the first 5 years. If they're not ready for school, they are going to be behind in school. And so we need to give them a winning chance. And especially when you think about marginalized communities, children that don't have access to everything that children may have. We need to do everything we can as a community to come together to give these children a fighting chance. And it is everyone's problem.
Yeah, I want to echo what you just said, Dulce. I think this is an issue that we need to garner funding for. I think right now we're in a space where we have an opportunity to think what that's going to look like in our state, but it will take systemic change, and we will need to think of really localized and also statewide solutions to think about how we can keep the doors open for different childcare centers, as well as being innovative and thinking of how we can open new doors.
Here in Wayne, we've already kind of explored this a little bit with a preschool setting. The district has what they call an early learning center that is income qualified primarily, and for ages 3 and 4 preschool. And it has had extremely good success, not just in the number of students that they've been able to get into that program, but the services they've been able to provide those students in the program. They've identified a lot of systemic issues, educational issues that these students might exhibit very early. They've rectified it, and then when the students go mainstream in the K through 6 setting, the issues are no longer a problem. They're able to be a part of the mainstream student body without a lot of problem. And I think they've also kind of done some analysis of the cost savings of the special education program too. By having that early learning center, it has reduced the cost of the special education program at the elementary school level.
Yes, I think that cost savings is such a unique way to look at this, but also a very important way. And I would add that there's also been some interesting research about cost savings later in life when we look at incarceration and students who might have attended like an early Head Start program decades ago, and the different outcomes we can see and how that actually does end up saving us some money. I also think it's important as we look at, these programs that might provide early care for all, and how amazing that sounds. And yes, that sounds so great. But we often feel some pushback from that. But really, if we consider how our family structure looked very different when this whole design came about, when children weren't going to school until 6 or even 7 before we had universal kindergarten. That was when we had lots of multi-generational living. The grandparents were in the home and able to help with childcare. There was often only one parent working and not 2. But now family structure looks very different, but childcare structure has not changed. So yes, we do get some pushback when we talk about, free and accessible childcare for all 0 to 5. But if we consider how things have changed at the society level, it can feel more comfortable to say, okay, yes, this is a need for us. This is adjusting to our current settings, and maybe it is something that we can look to implement.
Okay, so let's see here. We've got another question on Facebook. This one's from Emily. For employers who are already struggling to keep their doors open, are there grants or additional funding resources available to help them offer stipends for childcare?
I believe right now there's some current legislation being reviewed on potentially providing a stipend. Whether that is going to pass or not, I'm unclear. But it's things like that, the creative thought process of providing some type of stipend or assistance to parents or to the providers is something that we desperately need in this state.
Okay, looks like we have another phone line question. So we're going to go to Garing and talk to Karen.
Yes, hello.
Hi.
I'm Karen, and I'm a senior citizen. And when I got this phone call, I really wasn't prepared to write a bunch of notes, but I'm hoping that sounds like it could be a very interesting thing for me to get involved in. I am a previous special ed teacher, and I do appreciate the preschool work I got at Hayes Center. The people were really wonderful with me over there. And the question I was approaching was, how are we organizing this information? All of the people that have been on so far have so much good information. I didn't take notes, and I was wondering if you would make a good pamphlet or something that we can continue to put out and kind of, give us a little idea about how to set up our speaking programs.
Okay, so we do know that this presentation, this video and everything will be available online. Dr. Holly Hattenbowers, I don't know if you want to say something about tomorrow's release as well for some of that information.
Yeah, so there'll be additional survey results shared tomorrow, and you can register. And I think we have it at the bottom of the page, and also you can go to nebraskacaresforkids.org to get more information. There's also going to be lots of resources and tools shared on nebraskacaresforkids.org. A lot of the toolkits that we've talked about, the checklist, the where to find, how to potentially have childcare as a business, can all be found at nebraskacaresforkids.org.
Okay, now the phone line's heating up, folks. Let's go to Hastings and talk to Robert. Hello, Robert.
Hello. I'm a retired child care specialist and also neurofeedback and exercise therapist. Served as a tutor for children with learning difficulties in our county in Florida before I retired. I have some sources that would be of interest to parents who find their children perhaps having learning difficulties, and that would be through people who have a background in Educate for Kids, educational kinesthetics. Educate for Kids was by Dr. Paul Dennison and his wife, and that exercise program is also very similar to that which can be obtained online, and even a book, When Bright Kids Can't Learn. And online you can find that book of exercises at Amazon or other booksellers, or you can download a copy online from the site learningtechnics.com. The exercises, both with Educate for Kids, which many teachers obtain training during the summer on continuing ed credits, that can be obtained in Omaha or in Denver, in a few other places. Summer training and exercises that can help child care specialists or paras or teachers to get some background in exercise that will enable children to learn more readily. The kinesthetic exercises allow the child's development of new brain avenues that haven't been used or perhaps have been disturbed by some accident or some other problem. Those exercises can teach the child how to do crossover and other skills by ludic exercises that also enable the child, after the exercise, to do better on their learning, on retrieving information and retaining information. That website is, once again, is learningtechniques.com, and perhaps a book in your local library on Educate for Kids or Biokinesthetics for Kids.
All right. Well, very good. So it sounds like there's some additional educational resources and some potential curriculum that if folks would want to take a look at that. So we do have a comment from Shannon on Facebook. I think that another huge part for employers is to understand that their employees are going to have times that they have to take time off work due to children being sick. As a provider, I see the stress that parents have and their concern they may lose their job and income because of this. This also stresses childcare providers as we are trying to keep everyone in our care healthy. And when parents are trying to stay at work as long as possible and prolonging the amount of time children who are sick staying in the center or trying to bring children when they are sick. So there's a comment on, really the impact to employers. And so, I guess one of the other things that I'd say from a business perspective or from an employer perspective is that there is an economic impact that they can feel, that they can see, that they can understand when parents can't make it to work due to inaccessible or inefficient, I guess, childcare. And so we've got a question from Jason on Facebook. As a resource for advocacy, is there a statewide, county by county, or report that might highlight the shortage? I'm not sure what that county.
I'd have to do some looking. I'm thinking that the question is about highlighting the shortage of childcare opportunities in different areas of the state. And I am going to assume that we do have that, but I don't have it out top of my head right now. So that might be a resource that we can look at adding to the wecareforkids.org. But yeah, I'll have to do some thinking about that. Does anybody else know of something?
I mean, Mike, didn't you guys do that high level research not too long ago, the impact to businesses, with the bottom line report?
Yeah, sure. So First Five Nebraska, we partner with the UNL's Bureau of Business Research to have a report called the Bottom Line Report. And it did look at the economic impacts of inadequate childcare, and really found that there are three major areas where there was impact. Obviously, to the working family's income, to employers' income, and then finally to the state of Nebraska. And so when you looked at all the factors, there was $789 million annually lost to those three areas. And when you apply a multiplier effect, which is a term that's used in economic development circles and economics in general, a multiplier effect is so that for every dollar that you would spend at a place, it would roll through the community so many times. With that multiplier effect, it would come to $1.39 billion annually lost to, again, working parents, to employers, and to the state of Nebraska. $1.39 billion annually. So that was all pre-COVID. We are looking at and anticipating an update to that study at some point. But just know that there is an economic impact to inadequate childcare in Nebraska.
And
Go ahead.
That's just it's a really good tool for us as economic developers when we're boots on the ground trying to share this with businesses. Sometimes businesses don't think in terms of anything except the dollars and cents, and what this means for their bottom line. And so having that data has been really effective in sharing that awareness for why this is really important to champion in our communities.
Absolutely. Yeah. Yeah. Yes.
And can I quickly add that I think advocacy group or a resource in our state is Communities for Kids. So I encourage you all to look at Communities for Kids as a really impactful and significant way to look at the localized efforts of bringing about quality care and education in communities across Nebraska.
So we have just a few minutes left in today's discussion before we wrap up. One final question for each of the panelists. We have a lot of Nebraskans on this town hall. What's the top message that you hope that they leave with? And what is one thing they can do now to help Nebraska solve its childcare crisis? Dulce.
Well, I am going to again talk about early Head Start programs. For more information about the toolkit, please go to nebraskaearly.org. And the number one thing that they can do is tell them that there is a crisis and we need to take action today.
Luke.
I would say go to the Nebraska Referral Network and look at what the landscape is in your community or your county. Start getting familiar with who those childcare providers are, whether it's a commercial setting or an in-home, and just give them a call, see how they're doing. I mean, that's something that we as economic developers do with businesses across our community and our county on a daily basis. We just do these check-ins. And I think to Claire's point earlier, this is going to be going a long ways to make sure that our childcare providers are seen and heard. And then they can do their job more effectively because we're filling their cup just in the slightest way.
Dr. Holly Hattenbowers.
I think be a part of the effort to increase awareness of our crisis of early care and education as a need throughout Nebraska, and identify a way that you can be part of the solution and the opportunities to really make our state the best place to raise a baby and a young child. So get involved.
Last but not least, Claire.
Yes, I think as much as we can, we want to be supporting those around us. So if you have a child in a care setting, ask that care provider, how can I support you? What would help fill your cup today? What would make you feel appreciated? If you don't have a child in a care provider setting, or you don't have a young child right now, find a parent who does and ask those same questions. You know, how can I support you? What would fill your cup today? Really just bring awareness to the idea that this affects all of us, whether or not we have young children, and we want to be a community that supports one another.
Excellent. Well, it was a pleasure to be with you all today. For more information about everything that we discussed and to find information about early childhood education in Nebraska, visit nebraskacaresforkids.org. This concludes our program. Thank you for joining us.